Uterine fibroid is a non-cancerous growth that occur in the uterus of females of childbearing age. They are growths that cause bleeding in between your periods, difficulty passing urine, cause pain in the abdomen because these growths cause pressure on the organs around it. Although uterine fibroid is not much spoken about in the community, it is very common. The incidence stated is about 70 to 80% of all women. That's a very high number. But it's not all those who need treatment. Some of them have very small fibroids which do not cause any problems. It's only in 25% of those 80% that there is symptoms that are caused because of fibroids which needs treatment. When it comes to treatment, there are various treatment options available. There are surgical options and there are minimally invasive options. One of the treatment options is hysterectomy. Hysterectomy is basically removal of the uterus. It is a very effective treatment option, but you lose a uterus. The other minimally invasive treatment option is something called uterine fibroid embolization. It's a minimally invasive procedure where we cut off the blood supply to the uterus and try to shrink the fibroids, but keep the uterus, so you save your uterus. This procedure is done in a minimally invasive manner. We make a small incision in the wrist or the groin, preferably the wrist. Under X-ray guidance or ultrasound guidance, we put a small tube or catheter that goes all the way to the uterus, and we put small bead particles. It's basically small particles that block the blood supply to the uterus. Once we block the blood flow, the catheter is taken out and a band-aid is placed on the wrist and the patient goes home in an hour or two. Now, one of the side effects of fibroid embolization is pain because you're blocking the blood flow to the uterus. We do have this unique option of decreasing the amount of pain after fibroid embolization. We have a unique method of numbing the nerve around the uterus to decrease the amount of pain, which dramatically improves patient satisfaction. Patients go home early, they have much less pain than they should have, and they get back to work much faster.
At SLU, we offer some sort of innovative ways to treat your fibroids. We're the first in the region to do procedures via the radial artery, which is a great advantage, especially for fibroid treatment, because instead of having to lie in bed, patients walk out an hour or 2 hours later. It's a great advantage as opposed to the traditional way, which is going through the groin. Quality of life significantly improves, and patients really recommend this procedure to their peers because it's a great option for someone who doesn't want to undergo surgery.